If I conferred with our furry friends, man to animal, think of the amazing repartee. If I could walk with the animals, talk with the animals, grunt and squeak and squawk with the animals, and they could talk to me.
Hello and welcome to Pet Watch, a monthly program about the Williamson County Animal Center. I'm Debbie Sims and I'll be your host today, and my special guest is Dr. Ashley Manos. Hi Ashley, how are you?
I'm great.
I'm going to call you Ashley if that's okay.
That is perfect.
And our third little guest here is Millie. And to start things off today, I want to tell you that Dr. Manos runs the Mill Creek Animal Hospital. That is her clinic down in Nolensville. And she has an interesting story about Millie. Why don't we just start with her, because she's so interesting and it sort of indicates the way you practice medicine.
Okay. Well, Millie here came to us when she was about maybe 5 or 6 weeks old, and her owners had found her stuck in a work sawhorse, and she had a broken leg, and they weren't able to take care of her. So we adopted her and fixed the leg, and she's sort of become our mascot, and she lives at the clinic with us and is somebody that many of our clients come to visit along with our other house cats.
So she roams the clinic and
She does.
pretty much rules the roost there.
She does.
Yeah.
Yes.
Does she drink water out of the faucet? Because I've heard cats like to do that.
She is not her, but the others do.
The others do. How many cats do you have that are at your clinic? That
We have 4 total, including Millie.
Now you have worked with Williamson County Animal Center in something called Cat Connection.
Correct.
Before, where some of our cats come down and live at your clinic until they're adopted.
Yes.
How has that program worked for you?
I think it's been wonderful. The community knows that we keep cats there, and we've adopted, I believe, 5 so far out of that program, and the cats just come in, we get them acclimated to the practice. They are not kept in a cage. They eventually are just wandering around with the other cats, and so the clients can come in and interact with them. So I feel that gives them a little bit better chance of being adopted, because you can see their personalities. They're not in a cage all the time.
Right.
And we do try to keep older cats versus kittens, because the older cats have a tougher time
They do.
getting adopted.
They do. Everybody wants a kitten, but senior cats and older cats with distinct personalities, by
Yes.
the way.
Yes.
I've found out that the cats do have very distinct personalities. So what's Millie's personality?
Millie is very laid back at the clinic. She likes to interact with the cats that come in. Oftentimes we'll be in a room examining a cat or even a dog, and we'll see a paw come under the door, and we do have several long-term cat patients, and what I mean is they come in daily for fluids or something like that. And their owners are all friends with Millie. Millie would come in the room sometimes and sit with them in their laps. Millie is a lap cat, so she's either in one of the staff members' laps or with one of the clients or in one of the cat trees up front sleeping.
Back to her little broken leg, she can use it somewhat now, but many times people believe that animals can't survive with a broken leg, and they might
Correct.
be saying, well, you better humanely euthanize my cat because she has a broken leg. So
Yes.
Hats off to you for acting like we do at the shelter, that everybody deserves a chance to be saved. She's so cute, and it's so interesting that you have the little mascot cats in your clinic practice.
Yes.
And you do
Yes.
treat dogs as well
We do
at
treat
Mill
dogs
Creek.
as well. Yes,
Okay.
absolutely.
Now, how did you get interested in veterinary medicine?
I think like most of us, I, as a child, wanted to be a vet, but I grew up in a rural area of Alabama, and I was always saving things. There would be birds or cats and dogs that would wander up or honestly be dropped off at our house, and I would take care of those, and I really didn't think much more about it. I didn't intend on being a veterinarian until about halfway through undergraduate, and I decided that I was going to go to vet school.
You were going to be
halfway
a
through.
writer? Or
A writer. I was an English major, a creative writing major, possibly teach, but I decided about halfway through that I would switch to biology major, and
Wow.
applied to Auburn and got in.
Wow.
So-
So you went to Auburn School, Auburn?
Yes, Auburn College of Veterinary
University
Medicine.
College of Veterinary Medicine. I
Correct.
always try to get that right. We have a lot of veterinarians in this area that went to Auburn.
Yes.
Well, when you were a child and people were dropping off animals at your family's property, maybe they heard about you and that you were going to take care of them.
Maybe so.
What was the most unusual thing you ever took care of?
A little bird, and I can't remember the species, but it was this long-billed little bird that had a broken wing, and I found it and had tried to nurse that bird back to health, and of course he didn't make it, but that's probably the most unusual thing that I'd seen come up into the yard.
And you were how old at the time?
Oh, I don't know, 7, maybe 7 or 8, pretty young.
Yeah, and when you went to veterinary school at Auburn, what other animals were you exposed to? You kind of exclusively deal with cats and dogs now.
We do.
But what's veterinary school like? What do you get a glimpse of there?
Everything. So you learn all the species, all dogs, cats, of course large animal. We did deal with some unusual animals. Some of the people that lived in Lee County had things like camels. We did surgery on a camel once.
Camel,
so
wow.
we had goats and pigs, horses, cows. There are large animals that live on the vet school property. So there are cows, horses, goats that are taken care of by the school. And of course, small animals too, small animal medicine and surgery. Saw a few birds, did a little bit with exotics like snakes or hamsters, lizards, that type of thing. Not too much, it was more elective courses, but I think the schools are getting better about including more exotic animals and pocket pets.
You see a lot of that with pet lizards and
Yes.
snakes and things that I'm sure they look for a veterinarian that has that. Well, what led you to somewhat specializing in feline medicine?
I think I found them challenging, and I felt a little bit that they were truly underrepresented in veterinary medicine. Most people don't think cats need a lot of veterinary care, and I think that they're not well understood, and they're certainly not just small dogs, so they have their own diseases and their own ways of responding to things. So I think I like the challenge, trying to solve the mystery.
Solve a mystery. Yeah, cats can be mysterious. Yeah, they can. That's part of their appeal, I think.
Yes.
Is their independence and their mysteriousness and their variations in the species and coloring. She's got a little divided color on her face and those beautiful eyes. Most of us, when we go to the vet, it's because our pet is either sick or something's wrong or they're limping, or we don't usually get to talk to our veterinarian about their philosophy of medicine. We're just like, what's wrong with my animal? Can you fix it? I'm worried. So let's talk a minute about what's your philosophy of veterinary care. What do you want your pet owners to know about caring for their animals?
We are very proactive about trying to be preventative. So, more than just, they have to come in once a year for their vaccinations, or they're ill and we're, trying to deal with an illness. We put a lot of weight on preventative care and annual examinations, seeing some animals twice a year depending on their age, because that allows us to find things before they become an issue and really talk about things that we can do and the owner can do to keep their pets healthy and prevent disease and keep these animals living for a long time. So we're very heavy talking about dental care, preventing parasites, keeping these guys healthy through their diet, and also a little bit of behavior and controlling stress, especially with the cats.
So the annual wellness exam is important, like it is
Very.
with children and adults. You shouldn't just go to the doctor when you're in a crisis.
Absolutely.
You should go regularly so they can monitor your body systems, and that's the same philosophy you have with the dogs and cats in
Absolutely.
your care. Let's talk about fleas and ticks.
Yes.
The weather's getting warmer, and there are a lot of misnomers out there. People will say, oh, I have an indoor cat. They don't need to be treated for fleas and ticks. What do you recommend for cat owners?
All cats, indoor, outdoor, and indoor especially, people do think that. They think my cat never goes outside and I don't need to worry about flea or tick issues. And that's just not true. Our homes are very nice areas for fleas to live in, especially they can overwinter in our homes. The temperature and the humidity are great for a flea to overwinter. And you don't think about, perhaps you have a dog that lives in the house with a cat, or you're coming and going out in and out of that house, and you could be carrying fleas in and out. And so if your cat is not covered or your dog is not covered, then you could end up with an issue where you have a flea infestation or a tick infestation. They're active 12 months out of the year.
What do you recommend to your clients for flea prevention?
We love Revolution. Revolution for cats is my favorite. There are more choices with dogs, so it is really more of a discussion about what works for that owner. What are they willing to tolerate? And what I mean by that is different preventions will behave a little bit differently as far as what's life cycle, part of the life cycle that they are controlling.
Right. But the point is to talk to your veterinarian and get on a flea and tick prevention program.
Yes, year-round.
Fleas are an annoyance, and you don't want an infestation in your house. Your animal can be miserable. Some pets can be allergic to fleas, cause hair loss, itching, just irritation. Ticks take it to another level.
Yes.
What diseases can a tick give an animal?
There are lots. There's also a lot that fleas can give as well.
Oh, fleas can as well.
So they are transmitters of disease. We think more about ticks because you have people more familiar with Lyme disease or Rocky Mountain spotted fever. We see a lot of Ehrlichia in Nolensville, and it's in the human population as well. So we do a lot of
disease?
Ehrlichia.
Ehrlichia
Ehrlichia is a tick-borne disease.
Tick-borne, okay.
Nolensville has a lot of issues with a disease called bobcat fever that is spread by ticks. It is a feline-specific disease, and there is truly no good cure for that. It is still a disease that can be fatal in a large majority of the cases. We have some better treatments in this day and age, but it is the first community I have practiced in where the majority of my clients are familiar with this disease before I have to explain it to them. So bobcat fever is very well known in Nolensville, but anyway, the ticks can spread disease to us, to our families, to our pets, and that is also going back to preventative care. It's not just about taking care of the pet, it's about keeping your family healthy, because people don't often think that your pets could potentially be bringing some diseases into the home that could affect you.
And the product you mentioned, Revolution, that you work with most of your cat clients, does it kill both the fleas and ticks?
We like that. It does not kill ticks, so there are often instances where you need two products, and I guess an easy way to remember that is if you, right now, in this day and age, if you're using a heartworm preventative, it will not have a tick preventative in it. If you're using a tick preventative, it will not have a heartworm preventative in it. So with dogs and cats, we protect them against heartworm disease, and often there's a lot of products that will also protect against fleas, but you need a secondary product that's going to kill and repel ticks. So in cats, for instance, we like Revolution because there's not a lot of options for heartworm prevention and flea prevention. So that product is heartworm preventative. It deworms against intestinal parasites. It keeps flea eggs from hatching, and it kills the adult fleas. And then we like to add either like a frontline, some sort of topical that kills fleas and ticks, or we've had a lot of good success with the Seresto collars, which are not the old stinky flea collar you used to know and probably detest, but it does a great job of repelling ticks and killing ticks as well as fleas.
But you need to discuss this. People need to discuss this with their
veterinarian.
Don't go to the store and buy all these products and use them all together.
Yes.
That is
there are some
bad medicine, so to speak.
It can be. There are some over-the-counter products that are not truly drugs. They're more like a topical under the Environmental Protection Agency's control, and they can be, cats can be sensitive to those, some dogs too, but particularly cats can be sensitive to some of the over-the-counter flea products. And I have seen cats get very ill from application of those. So regardless, you need to talk to your veterinarian.
And there are collars that kittens can't tolerate.
Absolutely. Absolutely.
If you go put a certain type of collar on, flea collar or preventative collar on a kitten, you could have disastrous consequences.
You could.
Because it's too strong?
Well, some cats are sensitive to that particular ingredient.
So just like people, they kind of have reactions and allergies. Some of us have them, some of us don't.
Yes.
Let's talk about heartworms, because that's not a flea or a tick issue, that's a mosquito issue. So that's another level of prevention for our animals. Heartworm preventatives are usually given by mouth?
Usually there are some topicals. Like I said, with cats, there's not as many options. There are more options with dogs. You've got topicals or chewables. But regardless, and even if they're indoors, and I do hear that quite a bit, we still recommend heartworm prevention year-round because we find mosquitoes in our home. So.
You know, if you open a door and a mosquito can fly in, bite your animal, and they could contract heartworm.
Absolutely.
And cats do get heartworm disease.
Cats do get heartworm disease.
I think that's another misnomer that's out in the community. Oh, that's a disease that only dogs get.
Yes.
Not true.
Not true.
So remember that when you're doing these preventative things, that the heartworms, we get a lot of animals at the shelter that have not been protected against heartworm.
Yes.
And it can be debilitating depending on how advanced it is, and very expensive to treat.
Yes, very expensive.
And, you know, between $1,000 and $2,000 sometimes. we have to get donations when we have an animal that needs that kind of level of care. And then there's the treatment. They have to be limited for the walking. I know in dogs they have to be limited, their activities limited, because the medication is so concentrated on the heart to kill the worms that it can stress them. So
it's not without risk to treat. It's much safer to prevent.
Much, much safer. It's like rabies. Why not? Please, because it's such a simple vaccine. And don't say, oh, my dog's not going to get that, because we have seen rabies this year, by the way. Let's talk about that for a second. I saw a report from the Tennessee Department of Health that there had been 2 or 3 animals, pets, who contracted it, and maybe 5 wildlife where it had been found. So that is very preventable and 100% fatal.
100% fatal.
So if your dog contracts rabies, or your cat, and cats can get it too.
They can.
They usually contract it from wildlife.
Yes.
Like in this area, I believe it's usually been skunks.
A lot of skunks in the area.
In different parts of the state, it's different things. If you travel and you take your animal with you, it's vitally important to be immunized against rabies, because as you approach different parts of the country or go camping or whatever, it's different in East Tennessee and it's different in Arizona than it is here. But rabies does exist, and if your pet doesn't get it, then your family can't get it, or a passerby who your pet might have an encounter with can't get it, and you'll be asked to produce that record.
Yes.
So it is on the owner, and we've been stressing that rabies prevention is so easy, and there's so many places, including your veterinary office, that you should get that shot and prevent that from happening in the community.
Absolutely.
You mentioned dental care. That's something fairly new in veterinary medicine. I know in years past, if the dog had a bad tooth, the vet worked on it.
Yes.
And then, about maybe 10, 15 years ago, vets started saying, we need to clean these teeth like people get their teeth cleaned. What's involved in a dental cleaning?
Well, a good dental cleaning within the hospital is going to be a sedated procedure, just like any other anesthetic procedure, like a spay or a neuter. And so we go in just like you have your teeth cleaned. They are going to be scaled, they're going to be polished. We're going to look for evidence of disease. And dentistry has really changed over the past decade. It really is considered more of a standard of care to take some x-rays, and so that's changing with veterinary dentistry, because just like us, a lot of times you can't see the disease unless you take an x-ray and see what's going on underneath the gum line. But as far as a preventative procedure, just like we go and have our teeth cleaned every 6 months to a year, it is really vital to try to do that for our animals as well, to prevent that bad tooth, because I have seen some cases of very advanced disease where an abscessation has led to a jaw fracture because the disease is so bad, and that could have been prevented just by regular dental care.
And cats and dogs alike
get
what happens, bacteria builds up in their mouth because they're not brushing their teeth daily like humans, and then it gets under the gum line and begins to rot the root.
Correct. Just like us.
Okay, and you get
have periodontal
root canal or periodontal disease or whatever. And in most cases with an animal, it's an extraction is the solution.
Yes, and that's changing. We have specialists now, so there are some veterinary dentists specific. That's what they do. So there are more options available. There are root canals and other things that are done with animals.
Wow.
But in general, if there is a diseased tooth, most of the time the answer is going to be to extract that tooth.
I think that may be the future of veterinary medicine. I'm seeing cancer specialists pop up. I'm seeing veterinary cancer and veterinary ophthalmology.
Yes.
And these are specialized surgeries that if you were unable to do them in your hospital because of the nature of the disease or the part of the animal's anatomy that you aren't a specialist in, then you refer patients.
Absolutely.
Okay.
Yes.
What are some of the occurrences that might require a referral?
Well, we're very fortunate to have several specialists in Nashville that we can refer to. So orthopedic procedures. When I came out of school, I worked for an orthopedic surgeon for the first 3 years I was in practice, and I really feel that you have a better success rate when you have someone doing that does that all the time. So certain orthopedic procedures, fractured bones,
torn ACLs.
Torn ACLs are a big surgery. So just like a football player can tear that knee, animals can too, dogs can too, and so that is one of the biggest procedures that you'll see the veterinary orthopedic surgeons do. Cancer, you mentioned that, so we quite frequently refer to the oncologist in town to discuss whether that removal is needed or chemotherapy. Radiation can sometimes be an option. Internal medicine, and we do have neurology as well.
Wow.
And we have some behavioralists. We have access to some behavioralist veterinarians. So it's changed quite a bit, and we're fortunate to have those people here.
It used to, if you had something that was unusual, you hear stories of taking the dog to a veterinary school like Auburn.
Yes.
It's the only place where that was done, and I think now over the last 20 years, it's developed now that vets like you are choosing subspecialties, and animal science and animal medicine is becoming very much like people medicine in many ways. What are some of the feline diseases that are peculiar just to cats? I mean, I've heard of feline AIDS.
Yes.
And I've heard of feline leukemia.
Yes.
Address both of those and tell us, how do cats get that and how do you prevent it?
So they are immunodeficiency diseases. So the feline immunodeficiency virus is in the same class as the human immunodeficiency virus, but is a feline-specific disease. It is spread, typically we think of that disease being spread by biting or scratching. It's the fighting cat disease. And leukemia is also an immunodeficiency type of disease that's spread more by, mom can spread it to the kittens, close contact, living with other cats that have leukemia. It is out there in the feline community, and it is, as far as the short term, a much more serious disease. Cats do not live very long with feline leukemia. It is very preventable with vaccination. Feline immunodeficiency virus is a little bit trickier. We don't have a great vaccine for that. If we did have a good vaccine for our cats, we would have a vaccine for people. They're just very similar.
That's the one that falls into the AIDS category.
Yes, the AIDS category.
It's really FIV.
FIV.
Okay. So is that a bad prognosis for a cat that has FIV? Can they live?
They can live. It is not a death sentence like people used to think. So we do have some FIV positive cats in the practice. They live long, very normal lives. They are more susceptible to infection, and we certainly recommend that they be kept indoors so they don't spread it to other cats.
Right.
But typically you would look at a cat that we know has FIV, and you would not know that cat had FIV because they don't start to develop disease until much later in life, much like a person would develop.
And neither one of those are transmittable to humans.
Not
They're
transmittable
feline
to humans.
specific. Okay.
Feline specific. Yes.
What about diabetes? Do you see a lot of that in
We do.
cats?
Cats have a lot of diabetes. We see a lot more of it in our animal population. It sort of mimics the human population with diabetes, but a lot of diabetes in cats. Pancreatitis is a little bit different disease in cats versus dogs. We see inflammatory bowel disease. We see allergies.
How do you catch that an animal has diabetes? What are the signs?
The typical signs are going to be drinking a lot of water, urinating in large amounts and frequently. Sometimes the owners will notice some weight loss over time, but the biggest sign is going to be drinking a lot of water and urinating large amounts.
Well, we want to move on here if we can and talk a little bit about your kitten kindergarten class.
Yes.
You're so passionate about cats and kittens that you're having a class at your clinic,
Yes.
at your hospital,
Yes.
Mill Creek
Yes.
Animal Hospital. It's Saturday, May 28th.
Correct.
Okay. What are you going to do in kitten kindergarten, and how can somebody sign up?
Well, call the hospital. So
Okay.
we're asking that people sign up, because we're going to keep it to a certain number. Individuals that have a kitten are welcome and encouraged to bring the kitten with them. It's also going to be open to people that have older cats, but we are going to ask that they not bring their older cats into that, but they can come and be part of that. But yes, just call the hospital and we can get your name on the list for that. But it's going to be a free class. We're going to talk about just more cat-specific behaviors. People really don't think that cats can be trained or conditioned or responsive to treats, but there's a lot of things that we can do when they're young kittens to help them be calmer with transport in the carrier. That's a big thing. People don't want to bring their cats to the vet because it's so difficult to catch them or put them in the carrier.
Right.
So We'll talk about that. We'll talk about vaccinations. We'll talk about stress in the home, things you can do to socialize your cat.
Great, those
training.
are great information. Whether to declaw a cat, you'll talk about
Yes.
that,
Yes.
and what your feeling is about that, and they'll even get a goodie bag to take home.
Yes.
Now the clinic number is 819-2634.
That's correct.
Okay, so call Mill Creek Animal Hospital and ask about the kitten kindergarten class if you'd like to attend.
Yes.
I want to give our viewers a little information about what we're doing in the month of May. If you're watching this program on May 6th, Friday, May the 6th, you have until midnight tonight to participate in the Big Payback, which is where you can go choose a nonprofit, and we hope you choose the Friends of Williamson County Animal Center and participate in the Big Payback at thebigpayback.org. It's all online, and it's only during the 24 hours of Friday, May 6th. Now, I want you to remember that we recently opened a little area in the front of our clinic, in front of the center, called Meow Manor, and now we're opening up another free-roaming cat room. It's much bigger, called Purr Palace, and I'd love for you to come by and see that. The cats roam freely in there, and they have bridges and chairs and things to jump off of. And then on May 7th, we will be joining the fun out at Wolfgang Bakery, which is a dog treat store in West Haven from 11 to 3. And on the 14th of May, we'll be at Woodland Middle School during the morning and Sam's Club at Cool Springs for a cookout in the afternoon. We will be closed at the shelter on Memorial Day. I want to thank Dr. Ashley Manos from the Mill Creek Animal Hospital in Nolensville for coming by today. And
Thank you.
we learned so much about cats, and we saw a beautifully behaved Millie. Millie would look around, and maybe the camera can get a better look at your pretty face. If you're thinking of adopting a pet, like Millie or a dog, we sure have plenty for you to pick from at the Williamson County Animal Center. We're located at 106 Claude Yates Drive. That's right next to Franklin High School. Don't let the construction scare you away. We're actually getting a traffic signal at the corner of Claude Yates during this construction project. So we'll all work around it and hope for it to come to an end as quick as we can and allow better access in and out of our facility. So we're looking forward to that. We are open for adoptions Monday through Friday from 10 to 6, Saturdays from 11 to 3, and we're now open on Sunday afternoons from noon to 4 p.m. If you want more information, you can become a friend of ours on Facebook at Williamson County Animal Center, or you can go to our webpage, adoptwcac.org, and there you can sign up to participate in a golf tournament that benefits us. You can find out where we'll be this next weekend, and you can just find out about each animal through Pet Finder. You can read their profiles, look at their pictures, and come on over to the shelter and give a pet a forever home. I thank you for watching Pet Watch, and I hope to see you again next month.
If I conferred with our furry friends, man to animal, think of the amazing repartee. If I could walk with the animals, talk with the animals, grunt and squeak and squawk with the animals, and they could talk to me. If I consulted with quadrupeds, think what fun we'd have.
Hey, rodeo fans, the horses are ready, the cowboys are ready. Are you ready?
It's rodeo time in Franklin, Tennessee. Hello, folks. I'm Bill Fitzgerald, Executive Director of the Franklin Rodeo. Friday night, May 20th, is One Generation Away night. The Franklin and Rotary Club is asking you to bring non-perishable food items Friday night and every night during the rodeo. Help us as we fight hunger in Williamson and surrounding counties. We're also asking all rodeo fans to wear blue on Friday night to show support as we fight hunger. Get your tickets at franklinrodeo.com.
Rain Again by Gail Bunton Haddock. It's green again now that the rain has come back. I've been out in it. My feet are wet and getting cold, but no matter. The land was parched, the leaves brittle dry with fire and ever-present threat. With the rain has come a hush. It has settled on the far hills and across the fields. We were ready for the relief of this rain. Sometimes slow and soft, sometimes hard and slanting on a rush of wind, and in a quietness that heals the brutality of a too long drought.